Welcome to this special spotlight from the Center for Africa's Resilience to Epidemics Care based at the Institut Pasteur de Dakar. Today, we are joined by Isha Njai, Head of Care, to introduce a game-changing initiative, the African STARS program. It's a collaboration between CARE at IPD and the Center for Epidemic Response and Innovation at Stellenbosch University in South Africa to train the next generation of African leaders in biotech, public health, and epidemic response. Let's dive in. Aisha, what is the African STARS program and why is it important right now for Africa?
Hi, Denver. So as you mentioned, the African STARS Fellowship Program is a collaboration between CARE at the IPD and CERI at Stellenbosch University in South Africa, in partnership with the MasterCard Foundation. It's a program that we launched earlier this year in January and has been the brainchild of Dr. Amadou Sall, who is the Executive Director for Manufacturing and Supply at CEPI, as well as Dr. Tulio de Oliveira, who is the Director at CERI at Stellenbosch, together with Richard Gordon and Solomon Zewidu, who is the current CEO of EndFund. And what brought this about is taking into consideration that despite Africa accounting for about less than 20% of the world's population and having a substantial percentage of the global burden of disease, we have contributed 2 to 1% of medical countermeasures such as diagnostics, therapeutics, vaccines. So there is a clear need to build capacity within the continent to address the unequal distribution of research efforts, building capacity in genomics, in diagnostics, vaccine design, and also making sure that we can retain skilled personnel. This has become very critical. So the African STARS program, it's a capacity building initiative aimed to strengthen the next generation of African scientists and innovators that are working in biomedical research, public health, biotechnology, and it is co-led by the Center for Africa's Resilience to Epidemics at IPD, as well as the Center for Epidemic Response and Innovation at Stellenbosch.
Excellent. Aisha, what role does CARE play in the program and how will the fellows be trained?
So, as you know, CARE's main objective is to train the next generation of leaders, decision makers, and actors involved in epidemic fronts, to also promote disease intelligence by collecting, storing, and analyzing epidemiological data, and to also translate this epidemiological research into social value by fostering a culture of innovation and entrepreneurship. Now, with CERI being one of the 3 specialized genomics facilities of the ACDC, the objective of this partnership is to make sure that we leverage the expertise at each of the centers to ensure that we are building the next generation with a holistic training program. And at CARE, we will be hosting 2 tracks of this African STARS Fellowship, which is actually made up of 4 tracks. So that's the Advanced Translational Teaching, called the ATT, also the Young Professionals Program, YPP, as well as an MBA in Healthcare Management and Leadership and a Master's in Bioinformatics. At CARE, we will be co-hosting the ATT and the YPP together with CERI. We will be focusing on the vaccines track. As you know, IPD has several major achievements, including being host for research, training, and biomanufacturing of vaccine. And since 1927 has been working on yellow fever and then the production of vaccines against yellow fever. And more recently, the IPD has built and staffed a state-of-the-art vaccine manufacturing plant in Jamnyajo. So it only makes sense that our key focus at the IPD for our ATT and YPP professionals would be in vaccine manufacturing. Together with vaccine manufacturing, so we have a series of technical trainings that we will do for them. The idea is to show these ATT and YPP fellows the entire value chain from research all the way to value creation. So we would look at things from quality and accreditation side, move on to things like biosecurity and biosafety, which the IPD is also a center of excellence for biosecurity and biosafety for the African region, and then move into looking at pathogens, host, vectors, genomic surveillance, pathogen discovery, and also move into genomic algebra, which is something that the IPD has recently started training on through Dr. Xavier Berthet, I think the past 2 years. From that, we will also move into the medical solutions, which IPD has been leading in the African region. In medical solutions, looking at things like vaccine research and development and design, where we have lots of experts at the VRC, so the Vaccine Research Center, the former AVBL at IPD, which has managed to really capture young African scientists to come back to Africa, which is also, I guess, another point of inspiration for the fellows that we will host. And then move into vaccine design, introducing these fellows to vaccine manufacturing, looking at things from upstream, downstream, fill and finish, which we will work together with the Madiba facility and the Madiba Workforce Development Program. And then from that, also highlight the diagnostics manufacturing, which is something that the Diatropics at IPD has been doing the past few years with Fondation Mérieux. And from that, we plan to show them research management skills, which is something where we find that scientists, especially in Africa, we're very good, or we've been trained greatly at scientific know-how, practicals with scientific equipments. But then sometimes we lack or are not as exposed as others to research management skills such as obtaining grants, managing these grants, compliance, financial reporting, at the same time even communication for science, so communication with the media and even writing. So these are skills that we plan to share with them for management, for leadership, core skills. And then also touch on entrepreneurship and innovation. How do you move this idea into something that's scalable, that's commercial? How do you identify your market and make sure that your product is tailored for your market? So we would also work on writing business plans, pitching business plans, showing them tips and tricks to raise startup capital, and also leading multidisciplinary teams. So also working with the private sector on this side, as well as the Grand Challenger Senegal team that we have here at the IPD. So basically making sure that these fellows have a very holistic, theoretical, but also very hands-on training for the next couple of months or the next 1 year, depending on which track they're on.
Okay. And today, Aisha, a very last question. What kind of future are you building with this program, and how can others get involved?
By strengthening the capacity in genomics, which is one of the key focuses of this fellowship across all the regions of Africa. Researchers and the healthcare professionals can then start to generate region-specific data and knowledge, which is crucial to understand disease dynamics and to develop targeted interventions, including the evaluation and development of diagnostics, therapeutics, vaccines to improve public health outcomes. We also plan to have an alumni network, which will be established for the fellows in South Africa and at IPD. So as you know, we are co-hosting. So we're splitting the fellows on the two campuses, CERI focusing on the genomics aspect, the genomics tracks, and IPD focusing on the vaccine manufacturing tracks. We do have modules that are complementary or that align. Make sure that each have our own tracks, but to make sure that there is an alumni network across all the campuses for mid-career scientists, even after they complete the program. So this network will serve as something that's a valuable resource for continued learning, knowledge sharing, professional development, and just to create a community of independent researchers. I think how others can get involved, for me, it would be to advocate to Africans working in Africa, outside of Africa, early entry or mid-level on these related career paths, to apply to the initiatives under this program to ensure that we can reach as many young professionals as possible, to be trained and skilled in the various aspects, but at the same time to return back to Africa and make sure that we are contributing to the future of epidemic resilience in Africa, of course.
Thank you very much, Aisha, for this inspiring look into the African STARS program. To learn more or support the initiative, follow CARE at IPD online and on social media. Until next time, stay informed, stay resilient.